The symposium brings together an extraordinary array of stakeholders to facilitate collaboration and an exchange of information, ideas, and strategies.
What is your narrative about how suicide impacts other communities? And what impact does that have on you? What responsibility do you have? What responsibility do we have collectively? Because within our response, we find connectivity in how we relate and how we decide it impacts us and how we accept responsibility or do not. That is where we find our connectivity. And I would ask the question that if we believe that suicide impacts us all, then why have we not done more to incorporate culture and ethnicity into our collective awareness?
There wasn't a place to have the discussion in a way where I could kind of retain my dignity. There wasn't a place to have the discussion with other people who were also openly saying, yes, I have navigated these thoughts. I've had thoughts of wanting to die, and this is the meaning that I made of them. So our groups tried to answer that question. Where do you go? Like, where do you go to have this conversation?
Across the lifespan, suicide is the 8th leading cause of death in Vermont in 2018, which obviously makes it a top public health priority for us. Intentional self-poisoning is the most common method of attempted suicide, but it is rarely fatal. Previous intentional self-harm events are associated with significantly greater risk of dying by suicide and a 4 times greater risk of all-cause mortality than the general population.
If you really want to help folks with their mental health, including people who are struggling with mental health challenges, we have to do more than just remove the negative things. In other words, mental health, true mental health, is more than just the absence of mental illness or the absence of psychiatric disorders. And that our goal should not be having somebody not be depressed. It really should be having somebody experience happiness. It should be well-being. And to get to that goal, we need to be able to think of more than just pulling away bad things, but really being able to help people cultivate and strive and think about positive aspects in their life.
In terms of mediating relapse, attempts of death, factors that mediate relapse, as I said, were these ABCs, which is, people sort of like antecedents, behavior, consequences. But what mediates relapse? Well, some triggers. So identify what those triggers are. And finally, the same thing goes for suicide attempts. That there are sometimes some people have triggers. I really think that when you're doing your intake with the patient, find out the pernicious factors and the protective factors. That can really help you. These are 2 critical pandemics, substance use disorders as well as suicide. And treating one will help the other and vice versa. But you have to ask. You have to be the one to go there.
I'm a big advocate for universal suicide risk screening for all patients in medical settings. And I believe the best way to do this is to ask directly. And I think clinicians should really use population-specific and site-specific validated instruments, so instruments that have been tested through research in order to detect and manage patients at risk for suicide. And the whole reason behind detection is so that we could use the medical setting as being a bridge for people to get help. Under detection is a huge problem. The problem is that these people don't walk into their doctor's office and say, I'm thinking of killing myself. And if someone doesn't ask them directly, are you thinking of killing yourself? They most likely won't talk about it. So the majority of suicide attempters go unrecognized because the majority of medical settings do not screen for suicide risk.
I think it's very easy for us to underestimate the role that we can have in helping someone find their reasons for living. When I'm talking to youth about suicide, I simplify it down to hope and pain. And that suicide happens when pain outweighs hope. And so in this moment, when we're talking to somebody, when we're being there for a friend, It helps to alleviate a little bit of, or hopefully a lot of that fear of, I don't want to say the wrong thing. We know how to support people when they're experiencing pain. We know how to hold on to hope or jump into the mud with somebody when they can't find it themselves.
As a school counselor, I've been doing this work for a long time. And, there seems to be a more openness to talking about self-harm. And, and it's important as an adult that I am well-versed in having those conversations. Kids are hearing about suicide and self-harm on YouTube, TikTok, and it's really important that I'm able to provide alternate and resilient messaging to offset some of the messages that kids are getting through YouTube, or maybe even through Playground or whatever they're talking.
So what happens over time with that intergenerational trauma? The research has been done to show that there are a lot of symptoms. This research was done with Holocaust survivors and their descendants, and with Native American tribes, with boarding school survivors and their descendants. And you'll see many of the responses when trauma, when you take away what caused these responses, you may mistake some of these things for culture. It is not culture, it is historic trauma in a community that has been oppressed.
So what are the main goals of the Cultural Brokering Program? Number one is to raise awareness about mental health and substance use within refugee and immigrant communities. We are also looking at implementing a culturally responsive universal screening model to address the stigma related to mental health and substance use treatment in any community, but especially communities that are new to the US or the US mental health system. To connect community members to needed services, but connect them in a culturally and linguistically responsive way.
We have to look at cultures of compassion. We have to recognize and understand what compassion fatigue and burnout are. We have to recognize that the importance of the resilience within all people, and I believe in shining the light on that, and the opportunities for wellness. We have to think about how we communicate, nonviolent communication. And then I think that we have to really consider organizationally how we go about intentionally setting up a framework. And many times we'll hear things that it's like, well, how do we make that happen? Well, there is a way and a process